session, so I know you're full. That was very exciting. And now you're going to have, you're going to feel what feeling over the top is. We get a half an hour with Robin Carhart-Harris now. If you need to stand up, please do. If you need to use the restroom, please do. It is Saturday, and he's out with his family, so we'll get a quick view of his baby with him. He warned me, and I said, we welcome that. We have good family values here. So let me give you some context. I'm going to invite Robin in so you can see him. So I'm sure that will take some finagling. And while he is joining us virtually, I'll give you some context and why I thought it was so important to have a dialogue with him right now this year. The context is mental health. We thought we had a mental health epidemic before, and now we really do. And there's going to be long-lasting dire consequences of the pandemic and of climate disasters, and our young adults are suffering the most. Illness is so difficult, and it can cause depression and anxiety, and mental illness is the epitome of suffering. It's really one of the worst illnesses to have. So many of you have had or have family members with depression and anxiety, and some of you know what serious mental illness is. And we don't have any cures. We do not have good cures. We're working on it. We've heard about some today. We've heard about promising natural methods like thermoregulatory changes from Ashley Mason. And we're really disappointed with antidepressants. There are very few people where it can really cure their depression. And it really helps in the realm of severe mental illness. And it works about as well as placebo in the rest of us. And it has side effects. It dulls our life experience. It dulls emotional experience. So psychedelics sounds exciting, and it is, and trendy, and it's not. So we have on the horizon rigorous new clinical trials that show us that there is incredibly promising acute, short-term, and long-term effects of psychedelics when used well in a therapeutic context for relieving depression and anxiety. The context is, many of you have maybe seen Fantastic Fungi or read Michael Pollan's book, so it's entering the mainstream. But there are really several leaders. This is very hard research to do. There are several leaders in the world. Robin is one of them. He's one of the leading neuroscientists, and he's done some of the best clinical trials. So Roland Griffiths had a trial of people suffering from depression and anxiety because of life-threatening cancer. And within weeks, they had clinically dramatic improvements in depression and anxiety that lasted 6 months at their follow-up point. And so there's been a lot of questions about what can this treat? And there's a clinical trial in the New England Journal of Medicine that Robin will tell us about that he recently published, comparing an antidepressant, escitaloprazolone, to a psychedelic therapy. And so we're going to talk about that. And what I hope to end with here in our dialogue with Robin is, you're all experts on physical health and the connection between mental health and physical health. And mental health is one of the biggest drivers of accelerated biological aging and early morbidity and mortality. And Moffitt and Caspi have some of the greatest papers on that in JAMA. And so while we're at the early stage of looking at relief from mental illness or clinical depression, there are so many open questions. There's this whole field of what's happening in the body, what's happening acutely, what's happening long-term. Does this also have the potential to change some of these homeostatic or allostatic set points in our immune regulation, our autonomic nervous system? So these are some questions Robin and his team are starting to look at. And I'm so happy and grateful that our colleagues have recruited him to UCSF. So he just came from Imperial College London, and he's out with his family. Welcome, Robin. Thank you for joining us.
Thank you, Alyssa. Nice to be with you, albeit remotely. I hope you can hear me okay.
Okay, I can hear you. So it's a funny meta virtual thing where I'm not in the Zoom room. They're projecting me into the Zoom room, and anyway, and then there's a video that's one level removed. So, but it's all working. So, Robin, I would love to hear from you. You know, let's start with your trial, and I also want to, really understand, well, why you chose depression and how psychedelics are different than antidepressants, and what you were most excited about in your findings.
Sure, yeah, happy to say, hopefully the noise of the Blue Angels isn't going to be an issue. I just saw one go over here. I'm sat next to an ice cream parlor in Oakland. My two little boys are having ice cream. But we chose in our trial that we had published in the New England Journal of Medicine to look at depression more generally defined. We'd done a proof of principle trial before this one in treatment-resistant depression, and found really promising signs of efficacy and tolerability with psilocybin therapy. Psilocybin found in so-called magic mushrooms, and the therapy component's essentially important, the psychological wrapper around the drug experience, trying to harness the drug effect. A key aspect of that, we think, is the plasticity induced by the pharmacology of the drug, and then harnessing that ability to change, to be shaped in a particular way with a therapeutic supportive container. So we chose depression more broadly defined because my sense was that actually the psilocybin therapy might have a better safety and efficacy profile in broader depression. And I didn't really buy the argument that patients would have to fail conventional antidepressant drugs in order to meet criteria for treatment resistance. For me, there was a sense from that first trial that we did that psilocybin therapy works differently to conventional antidepressant treatments, drug treatments, and actually better in a number of ways. The therapeutic action appears to be deeper. It seems to be of the nature of a insight-based treatment. Participants often describe feeling like they'd learned something about themselves and their depression and how it came about and how they might change their ways of thinking and relating to themselves and others after the experience. And so really very different to what you see with conventional antidepressant drugs like SSRIs. And so my sense was that psilocybin therapy could be useful earlier on in the development of a depressive disorder. So we went head to head with a conventional antidepressant drug, escitalopram. Actually, in terms of SSRIs, this is one of the best performing. It's highly selective as well for the serotonin system. So it was a good comparator. And people got 6 weeks of it. For the final 3 weeks, they went up to the maximal advised dose, 20 milligrams daily for the final 3 weeks of 6 weeks, and primary endpoint at 6 weeks. In the psilocybin group, you get 2 high dose sessions of psilocybin. So that's 2 doses of psilocybin versus something like 43, I think it was, of escitalopram. To control for the daily dosing with the escitalopram, people took placebo capsules daily in the psilocybin arm, and to control for psilocybin and the psychological wrapper, people in the escitalopram group got the same psychological support and actually got a very, very low dose of psilocybin, 1 milligram. So it was a tough test for psilocybin, I think it's fair to say, and quite a thoroughly controlled design, trying to control for all elements, the psychology of psilocybin therapy. Anyway.
So the main outcome, the primary outcome, both groups improved equally in clinical depression, and it was the secondary benefits that you saw in the psilocybin group?
That would be the most conservative way to frame it. So of all the efficacy outcome measures, only one didn't separate significantly in favor of psilocybin, and that happened to be our primary outcome measure. So if people look at that paper, they see that that dominates the narrative, that there's no difference to be seen. All I would say is look at the data, look at the supplementary material and the data there. Look at the response and remission rates. Remission rates were twice as high in the psilocybin group relative to the escitalopram, even on that primary outcome measure, the QIDS. So the most conservative thing you could say about the results was that psilocybin therapy was at least as effective as a gold standard treatment for depression, and probably more effective, borrowing Roland Griffith's words as he looked in at our results. So yeah, there's more we could say about the efficacy, but the side effect profile, the tolerability, again, different profile, but in terms of overall rates, at least as good in the psilocybin arm, fewer moderate and severe side effects self-rated by the patient. So, you know, promising, very promising of the results.
I am always annoyed when the take home is about the primary outcome, since that's all you can put in an abstract of you know, JAMA or New England Journal, when the whole story, the profile of findings does, you know, speak for itself. There's a story there. And we've posted Robin's papers on our UCSF webinar website that I've now emailed all of you listening and all of you here in person. So you can, they're very rich papers, very interesting. So everything we discussed today is there. I am just so interested in the emotional experience of people in these psilocybin trials. So you've published on differences in their amygdala reactivity to emotional stimuli, as well as these increases in so many measures of psychological well-being, of optimism and self-esteem, resilience. And so I would love to hear you comment on that. And you know, what is this mechanism of brain plasticity? What is really happening in the brain that's so different than an antidepressant response?
Well, the action of the psychedelics is serotonergic, but these are drugs that directly stimulate the serotonin receptors, and a certain one in particular that seems to be key to their general action and therapeutic action. That's the serotonin 2A receptor that's heavily expressed in the high-level cortex. And the effect of stimulating that receptor is to dysregulate brain activity and, in a sense, diversify the brain activity. And this seems to open up high-level systems in the brain, aspects of the brain that are usually more modular. And the buzz term, but it's a fair one, is plasticity. There's a wealth of evidence now of increases in cortical neuroplasticity with psychedelics, and the increases appear to be enduring as well. Some recent evidence for that published in Neuron. So yeah, the evidence is strong, whether we're looking in animals at anatomical markers of neuroplasticity, or in humans at functional markers, or at brain networks breaking down within themselves, but then broadening in their profile. So the general theme of plasticity and increased ability to be shaped or molded, somewhat synonymous with an increase in flexibility, is what we're looking at. And again, you know, to emphasize that psychedelic therapy is a combination treatment. It's wrong to think of it as just a drug doing something intrinsically therapeutic. Plasticity in and of itself isn't intrinsically therapeutic. So it's how it's harnessed, it's how it's channeled, and that's what we try to do in psychedelic therapy.
Mm-hmm. Right. The drug companies would be very happy if it was just a pill, but the therapy, the shaping, the values, the trust, the support, that therapeutic process and the setting is what is going to make it a positive plasticity growth experience or not, from what I understand.
That's right. And so also you could see the risk there with these drugs if they're taken out of context, if they're abused in a sense and taken, you know, in an environment that's stressful. You could see somebody pivot in a potentially negative direction in terms of their mental health. So I think it's healthy to look at these compounds in an objective way and understand the essential importance of the context, this, we call it set and setting around the experience.
Beautiful. So I'd like to ask one more question and invite questions from the in-person audience as well as the virtual audience, although I could talk to you for hours. I would love to think about or understand what's happening acutely in the body. I know that, you know, you've written about positive stress and allostasis, and I know you've studied not just, you know, what's happening in the brain, but also in the nervous system. And has any, you know, what's a research question you would love to address? And let me just give you a little context. In this room, we have the many pioneers in looking at biological aging systems and how those are kind of feeding back or afferent pathways to depression. So inflammatory processes, epigenetic aging predicting depression. So all this kind of feedback from the body that can also create these, you know, secondary mental illness and suffering.
Yeah, well, I suppose historically, you know, with these drugs that, you know, appear to be centrally acting, it's very easy to be, you know, centrally focused and ignore the rest of the body. And we're trying to change that. Personally, I am, you know, looking at brain to peripheral physiological coupling, looking at peripheral physiology more directly with different measures. We're looking at cardiac activity, heart rate variability, looking at heart entropy as well, the ECG signal and the diversity of that, and that seems to increase under these compounds. There's all sorts of ways we can look at coupling between body and brain. At Neuroscape at UCSF, we've got some cool toys to look at physiology. There's a lot that could be looked at, yeah, and you know, people report very general improvements in well-being post psychedelic experience, improvements in lifestyle, less drinking and smoking, better diets, this interesting, curious shift towards vegetarianism, veganism often. Increased sense of connection with nature, as sort of loose as that sounds. We've actually quantified that effect and published on it, as have other teams. So it's a very real phenomenon, a kind of hippification of people through psychedelic use.
Yeah. That's just incredible. We also have a strong group here interested in, well, public health change. Ah, there you are, cute.
That's one of them.
Public health change and climate change, and you know, how do we shift this kind of, you know, rigid societal way that we live in a carbon burning happy lifestyle. And I know that the FDA has prioritized psychedelics for fast track with so much promise as a therapeutic, and you framed it as a transdiagnostic therapy that could potentially have public health impact. So there's nothing more exciting if that, you know, than having that really in the next 5 years be regulated in a healthy way, and we need that. But this idea of, you found that there's more connection to nature and, you know, as you said, sensitivity, veganism, and we have experts here that are going to talk about compassion and mindfulness training. And I think the frustration we all have is understanding it's our mind that has created our, you know, our norms and our society, and it's our mind that needs to change. And so the moral you know, some of the kind of moral hallmarks of aging end up being that we need to actually live out our values and our feelings of compassion, altruism, interdependence. And so the policies that follow from that are the only thing that's going to really improve public health. So more social equity, social networks. Yeah, thank you. So there's this hope, you know, and maybe unrealistic, but is there a way to shape the psychedelic response toward actual change, actual societal change, and not just for people who are suffering, but for us to see interdependence more? And you know, it's brave of me to say that, but I really want to know, and I really wonder if this could help us.
Yeah, and you're not the only one. I guess a lot of people are wondering the same and wondering if we're getting carried away and projecting some kind of, I don't know, panacea properties into psychedelics. I think one way to think of it is that, you know, the answers are there already. It's just hard to unearth them. And these compounds are particularly reliable and robust in the way that they reveal, you know, egoic drives and habits of mind and behavior that are unhealthy, that contribute to personal and societal ills. They just do it very reliably, but you know, still in a certain container and with a strong community component. You know, I'm increasingly saying that psychedelic therapy should be seen as a combination treatment, but also as maybe a quintessential biopsychosocial intervention. It's a drug and it works, you know, on a certain serotonin receptor, but the extension of that effect through the individual brain, body, behavior, interactions with other beings is really profound, and becomes way more than just that initial, you know, molecular action at a certain protein in the brain.
Thank you so much, Robin. I'm going to invite people up for questions. And just the way that you're so objective and rigorous, and you can describe the profound experience that people have in a way that they understand. And of course, experiencing it is the only substitute for the words for understanding it. But I just find that you balance this world, this complex and, you know, extremely scrutinized world very well. So I'm just grateful for you, Robin.
Thank you. Thank you.
So please state your name and your question.
Yes. Hi, Robin. Thanks for joining us. This is Eve Ekman. And yeah, it's just wonderful to hear Alyssa kind of frame it for our audience here and then hear your perspective. One thing
can you hear Eve, Robin?
I can.
Okay, sorry.
One thing that is interesting, you know, you have this paper actually that I really love, which is looking kind of at the phenomenology of mindfulness and psychedelics and comparing it. There's a lot of people here who've been studying mindfulness probably for decades and watching it go through its ups and downs of public approval and acceptance and being able to really be able to stand behind this as an intervention that matters, which I think over time allows us to understand more of the differential benefits. And right now it seems, I was fortunate to be part of the 2018 study at UCSF, and we did the qualitative analysis of the study for existential and moral distress at a group of HIV positive men. And that qualitative paper, you know, we just published the bare minimum of what we could say. We really couldn't get into the transformation that you were just talking about. And at some point, right, being able to talk about those as we were talking about earlier with this idea of maybe something beyond just improving well-being and reducing depression, anxiety, the mystical type experience, right, which is very hard to quantify. And I'm curious, is that an important thing to mention? Or are we going to, in some ways like mindfulness, kind of be as secular as we can to reach as many people? Or do we want to open the door to those maybe more transcendent experiences? And is psychology ready to open up to that at a more a level where people can really accept it and engage? Because there's so much there of value that is spirituality, and that is a difficult subject, but you guys are already getting there. So I just love to hear a little more from you on that.
Yeah, I mean, it's such an important component. You know, the data tells us it is that these intense experiences and the quality of them are probably the most reliable predictors of the therapeutic outcomes. So they're essentially important. The next question is, you know, what are they, and should psychology look at them? Should neurobiology well, of course it should. I mean, what an opportunity to better understand these profound transformative experiences, and bring them more firmly into, I guess, the mainstream, so that they can influence more people by understanding them more. And I think, demystifying them in a way, the healthy consequences of that are tremendous. And it's about sort of broadening the interest in these phenomena, grounding them, understanding them, appreciating, their natural basis even more. And that, I think, will enable us to connect even more with, I'd like to think, the natural world. So it's a tremendous opportunity for science, for spirituality, for a number of different domains. So absolutely, it's important. It's so important. Yeah, let's get stuck in.
Thank you so much. We have 3 more questions. Eve, I just want to, you didn't actually state their findings, but people here can ask you later. But Eve actually studied Ajahn Lee's and Josh Woolley, who's a neuroscientist at UCSF, who's also doing amazing studies, have been publishing, qualitative papers as well as quantitative papers on this, and just fascinating. Okay, next question. Thank you.
Hi, really wonderful presentation. Really excited to hear from the author directly about that study. I was wondering if you could talk a little bit about your views on sort of the needs of the treatment package, both the dose and the therapy that goes along with it, and if you could say something about sort of taking small doses, without all those other treatment aspects, if you think that's another way that it may be more broadly implementable, if it still has any effectiveness, what's known about that area.
Yeah, well, it's this curious, term, phenomenon of, spiritual bypassing, in a sense of kind of, rooting around perhaps some of the difficult work. And I wonder whether this low dose microdosing phenomenon is a sort of psychedelic bypassing or a pharmacological bypassing, where there's this wishful thought that you can get all the good stuff without the work, And personally, I don't buy it. The evidence doesn't back it up. The evidence for microdosing's very thin. Conceptually, I could see how it could work if it could catalyze, say, practice, maybe spiritual practice. But that's not always the way it's being framed. And psychedelic therapy, the combination treatment, has preparation, psychological preparation, which requires really some bravery on the part of the individual coming in to open up, to be willing to share, to be willing to go to the difficult places, and then to have a supervised experience with, a sitter, a guide, a therapist, 1 or 2 with you, at least 1. And then afterwards, the integration work. What is that? The working through material, talking it through, integrating it, trying to make sense of it, trying to ground rather than be too, up in the clouds, or just stunned, shocked by the experience. Also to view psychedelic experiences as a practice, like spiritual practice is a practice, take the one seat. Who said that? Maybe Jack Cornfield has popularized that a bit, but the idea, you got to sit down, you got to put the hours in, so to speak. And there's a bit of work to do, after the ecstasy, the laundry, that was his book, wasn't it? And it's a great principle, it's too convenient to think you could just take a drug and instant enlightenment and it's as easy as that. To see psychedelic therapy as a practice, maybe, embedded in a broader practice, spiritual practice, if you want, could be a really healthy way to look at it.
And most of the results are dose response, and the more mystical the experience, the more therapeutic benefit. There's just so much evidence. You have to go through some stress to have that growth. Next question is from our virtual audience, Elisa.
Hi, Robin and Sons. This question is from Katie Davis, who wants to know your thoughts about I guess, psychedelics in comparison to ketamine, which has dramatic short-term benefits, and any ideas about common or distinct mechanisms?
Yeah, some evidence of neuroplasticity with ketamine as well. That could be a common denominator, and both sets of compounds increase glutamatergic activity, so excitatory activity in the brain. So that could be a commonality. There are also differences. Whether those are differences in the plasticity is an open question. Some recent data suggesting that the neuroplasticity with psilocybin is more enduring than with ketamine might explain why repeat administration is part of the ketamine treatment, typically, at least with ketamine infusion. I do, you can pick up on the bias here, but I think it's sort of data-led. I think there are aspects of superiority with the classic psychedelics like psilocybin in terms of toxicity. Ketamine has some toxicity issues, abuse potential. Ketamine has some abuse potential issues and addiction potential. And so the rapid action is a big plus with ketamine, but it's also there with psilocybin therapy, and maybe more enduring. So, I think ketamine's been useful the way it's had an impact on the medical mainstream and come in as a viable alternative to chronic pharmacotherapy. But I just wonder whether it could end up being a bit of a placeholder for classic psychedelic therapy. Not to say that classic psychedelic therapy has, limitations and risks and pitfalls, but there are reasons why people are getting excited about its potential.
Mm-hmm. Wonderful answer. Okay, our last question is from our mitochondrial expert, Martin Picard.
Robin, thank you so much. That was a really fantastic discussion. I've been hearing about psychedelics in the last few months and educating myself a little bit. I haven't had a psychedelic experience, but anytime I hear about this, it makes me wonder, it makes me think about sleep, which is kind of a daily occurrence of consciousness, leaving the body in some way. And when the human mind kind of leaves the body, it seems like good things happen. That's where, as far as we understand, the body, rejuvenates itself. And whenever the ego goes away, there's some good physiological things that happen. The body cools down, and there's all of these beautiful physiological changes. Metabolic demand drops. So, do you see any physiological similarities between the sleep state versus the state that's induced by psychedelics?
Well, yes. And when I came into the area, the PhD idea I had was that the psychedelic state is a hybrid waking dream state, that there's some aspects of REM sleep physiology, rapid eye movement sleep physiology, dream sleep, if you want, coming into waking consciousness. And so you have this hybrid waking dream state. And there's little bits of indirect evidence for that. If you give a psychedelic during sleep, you'll induce REM sleep and more intense, vivid dreaming. That's old work that I'd like to try and replicate, actually, but sort of suggestive of the relationship there. If you have a psychedelic experience and then you record sleep, you actually see a deeper quality of sleep. It's almost like you've expended your REM quota during the waking state under the psychedelic. Whether that's true or not, again, we're just kind of speculating at. So I think REM sleep particularly, and maybe the plasticity occurring there. But the themes that you're speaking to of sort of a recalibration, rejuvenation that can happen with the ego going to sleep, in a sense. Doesn't always, though. I mean, it can really fight these experiences. I can see how this idea of a sort of recalibration, reset is quite appealing. How we test it, directly is another question, but lots to do.
Yes, thank you, Martin. Robin, thank you so much. And we enjoyed, learning about your work. And again, his papers are in your email on the website. And just so much gratitude for your wonderful work and your time. Thank you.
My pleasure.